I think that it's important for providers and all people involved in the care team from the provider side work to improve the patients and their families' adherence to therapy. We know that when the clinicians assess and reinforce the knowledge base that the patients have about their disease, adherence to medication strategies and medication appropriate evaluations take place. We know that, for instance, dosing regimens that are simplified make adherence better. We understand that if the patients are able to take their medicines twice a day, it's far better than the complex regimens in which they're taking medicines 3 or 4 times a day. We know that simple things like electronic reminder systems, which help patients and their families understand it's time to take this medication, it's time to do a particular exercise, are effective. We know that simple things like mobile apps that remind the patient to do breathing exercises helps in this care transition. Patients with heart conditions take lots of chronic medications. There are lots of areas where the medications themselves are evolving. A great example of that is patients who have atrial fibrillation. Prior to the last couple of years, patients who were on anticoagulants only had a couple of choices. They either received a vitamin K antagonist or they received some sort of injectable product. Vitamin K antagonists, as everyone knows, are not only difficult to use, but they're frightening to the patients. They're frightening because we have them come in and repeatedly have the measurement of their INR. And we impart to them a sense of anxiety about the number. The development of the novel oral anticoagulants and their ability to be used over the last several years has dramatically improved the ability to reduce that level of anxiety while improving care. It's difficult to overstate the situation in which we can improve the level of care and at the same time reduce the patient's anxiety. The medications such as rivaroxaban and apixaban and dabigatran have greatly enhanced that capability. We really want to embrace as a profession the ability to grasp the transitions that are taking place and to use those to facilitate the patient's care transition and minimize their need to be readmitted to hospital and to be anxious about their care. The novel oral anticoagulants are a great example of ways in which we as providers can embrace newer medications to reduce the patient's anxiety and concern and improve the care transition. The novel anticoagulants such as dabigatran, rivaroxaban, and apixaban don't require any laboratory testing. They have many, many fewer drug and food interaction issues, and they work very well. But they have a side benefit, which is the patients and their families do not receive the anxiety-provoking continuous monitoring of vitamin K antagonist therapy. And in doing so, are more comfortable, are more communicative, and more likely to be compliant with their therapy.